Hi, my name is Caitlin Pinion, and my presentation today is over Watson's theory. Jean Watson's theory of human caring emphasizes that caring is the core of nursing. She believes nursing is about more than treating illnesses, but is about meaningful and healing relationships with patients. Her theory encourages nurses to care for the whole person, body, mind, and spirit, through compassion, presence, and respect. Watson has had a multitude of occupations, one of those being a nurse. While she was a nurse, she focused on authentic transpersonal relationships, compassion, and the spiritual and emotional dimensions of healing. She didn't just focus on the medical aspect. She believed a part of healing was more than just medication and treating. She instilled the importance of hope and faith. She was also a researcher. She researched and developed the theory of human caring. She researched the importance of showing compassion and building human-to-human relationships with patients. She also researched the benefits of having a positive environment involving the spiritual and humanistic approach. Watson was also a novelist. She wrote about the academic and theoretical topics in the field of caring science. Her novels included Nursing: The Philosophy of Science and Caring in 1979, and Caring Science as Sacred Science in 2005. Lastly, Watson was an educator. She held a multitude of positions at the University of Colorado School of Nursing. She was not only the Dean of Nursing, but also the nation's first endowed chair in caring science. Jean studied at the University of Colorado, earning her Bachelor's of Science in Nursing, Master's of Science in Nursing, and her PhD in Educational Psychology and Counseling. Jean is most known for her work in the development in the theory of human caring. Due to Jean's amazing contributions to the world of healthcare, she received the American Academy of Nursing Living Legend Award. There are several key points to the human caring theory. First one being holistic approach, meaning caring for the patient as a whole, body, mind, and spirit, not just the disease or symptoms. The next key point is human caring is central to nursing. Caring is the moral idea of nursing. The job entails more than just performing tasks or technical skills. And lastly, nurses' self-care. Watson believed that nurses needed to care for themselves, maintaining integrity and wholeness to be fully present for the patients. The nurse needs to ensure they are 100% so they can give their patients 100%. Here is a visual description. This shows caring moment plus caring consciousness equals transpersonal caring relationship. There are many benefits to this theory. Some of those are that it improves patient experience, meaning that patients feel valued, respected, and emotionally supported. The next benefit is the nurse-patient connection. The trust built between the nurse and patient can improve for better communication. Lastly, it improves clinical outcomes. Studies have linked caring practices with reducing anxiety, pain, and complications, as well as faster recovery times. Not everything is perfect, so there are some limitations. The first one is that it can be time-consuming. Spending the time building a connection with patient A will take time away from patient B. The next limitation is cultural variability. Watson's theory focuses on caring behaviors and spiritual connections. Sometimes the belief of the nurse doesn't align with the patient's about health, healing, and nurse-patient relationships. Watson's theory is still being applied today, making it easier for nurses and leaders to promote policies and organizational practices that prioritize compassionate care, adequate staffing, and supportive environments. Nurses can also apply Watson's theory to everyday care, like making sure the patient is in a comfortable environment and personalizing patient's care. Ever since I wanted to enter the nursing profession, I always thought of nurses to be compassionate. Nurses are the ones that should be there to put a smile on the patient's face after a long day of bad news. From personal experience, nurses have one of the most demanding jobs, but it is a great blessing to be able to help others.